So the second patient is a 40-year-old woman who's come into the office really for a routine physical. And what we're trying to emphasize here are some of the things that really should be discussed at around this time. She may have some symptoms. She may say that she's having a bit of flushing because she may be getting some of the signs or symptoms of perimenopause. Regardless, I use 40 as a point at which I talk to patients about three major things. The importance of exercise, not that I haven't talked about it before, but I really try to emphasize the importance of exercise, in particular because of its relationship to reducing heart disease. And it's very important to recognize, we talk about breast cancer, but in fact, and we talked about this in the session in Mississauga, really heart disease kills more women than does breast cancer. And so it's very important to have a good heart health, not just good breast health or good, the heart health is extremely important. So exercise, I recommend at least half an hour a day for at least 5 to 6 days a week of good cardiopulmonary exercises. I also emphasize the importance of high-impact exercises and weight-bearing exercises because of the impact of exercise on reducing osteoporosis. There's some research to suggest that it reduces the incidence of some cancers, for example, breast cancer. It improves the mood. It reduces intrinsically the blood pressure. So there are a lot of advantages to exercise, and I really start to talk in great detail about it with the patient at this stage. The second thing is about the importance of vitamin D and calcium. And vitamin D has been mentioned already. There is more and more literature to suggest minimally an association, if not a causal relationship, between vitamin D and many illnesses. So, we see, for example, that in our temperate climates there's a much higher incidence of MS. And there's a belief now that there is some association between MS and low vitamin D levels. Clearly there is an association, or appears to be an association between vitamin D and colorectal cancer. And vitamin D is extremely important in terms of the absorption of calcium so as to, again, minimize osteopenia and osteoporosis. Osteopenia, there's the normal, osteopenia is just beyond the normal, and osteoporosis is beyond that. And it's a statistical thing that we're looking at. So I talk to patients about the importance of taking vitamin D and calcium. At the moment, we're recommending in the temperate climates 1,000 international units of vitamin D and about 1,000 milligrams of calcium in divided doses, sort of half in the morning, half at night, because your body can't absorb the whole thing all at once. And the third thing I talk to patients about, and we'll get into detail about this further, is whether or not we should be doing mammograms and ultrasounds or any other investigations, but specifically mammograms and ultrasounds beginning at age 40. There is much debate about doing it at that age. The debate stems from the number of false positives that we have when we do mammograms and ultrasounds at that age. There's no question if there's a family history it should be done, and perhaps even earlier. If there's a family history of breast cancer, if there's a family history of breast cancer, no family history of breast cancer, I will for sure start doing mammograms and ultrasounds or mammograms at age 50. And as I said earlier, if the patient is premenopausal, I do both modalities. And then I would do an examination, and it would be a complete examination. And I think this is really important in terms, philosophically. I think there's a tendency to try and fragment care in our system. As you know now, they've got a recent colorectal initiative. And not too many years ago, when the NDP was in power, and it was the year of women's issues, they brought out the breast screening program, the Ontario breast screening program. And everybody hailed it as a wonderful thing. And I remember asking the head of the program why this was being done. The mammography units that were being used for the breast screening program were nowhere as good as many of the ones that were used in hospitals and some of the private facilities. And the answer I got was, well, women aren't going to see their family doctor or their gynecologist, and so they're not getting their breasts examined and they're not getting their mammograms. I felt that was inappropriate because it also meant that they weren't getting their blood pressures taken, they weren't getting their pap smears done. So I really think it's important that when you're talking about care, it should be holistic care and not fragmented kind of care. And I mean holistic HO and holistic WHO. So in this patient, the examination is unremarkable. Investigations, I do some routine blood work. depending again on symptomatology, and I may or may not do the mammogram or ultrasound, and depending on symptoms, and this is where Dr. Petal is going to talk about perimenopause and menopause, I then decide what we need to talk about and what we might want to introduce.